Have you ever wondered if a man ejaculates too often? Is his body simply releasing tension, or is it quietly draining his drive like a battery running low? And that feeling afterward, the relief lasts for minutes, but then comes the crash, exhaustion, emptiness, and a foggy mind. Is that just psychological? No, it is a real biological signal involving a spike in prolactin and a crash in dopamine. If you have ever thought, am I overdoing it, but felt too embarrassed to ask, you are not alone. I'm Dr. Emily Carter, a urologist. Today, I want to speak plainly about something many men deal with in silence. While occasional release is healthy, ejaculating too frequently for your body's specific capacity can lead to desensitized nerves, a significant drop in motivation, and that unsettling sense of, I'm not the same as I used to be, even when your lab tests look normal. But there are also situations where a higher frequency isn't harmful at all, if you see to understand the difference between healthy release and compulsive depletion. If you want men's health content that is science-based, not based on myths or shame, subscribe to the channel so we can break down these hidden topics together. And right now, I want to know your baseline. Do you feel energized after release, or do you feel drained? Type the word energized or drained in the comments. I read every single one to understand what my viewers are facing. Now, before we talk about the ideal frequency, we need to clear up the most dangerous misunderstanding first. Because treating your body like a machine without recharge time is exactly where the damage begins. Many men walk into my clinic with one simple question, but hidden inside it is a much deeper fear. Doctor, I'm ejaculating too often. Is it harmful? And often they have already sentenced themselves before they ever hear the answer. One side believes that ejaculating too much makes them weaker, lowers testosterone, and drains their vitality. But the other side believes the opposite. The more, the healthier, that you need to clean the pipes to protect the prostate. See what is happening? The same behavior, but two beliefs pulling you in opposite directions, until your mind just gets tangled. The truth is, there isn't one single answer that fits everyone. Frequent ejaculation isn't automatically good, and it isn't automatically bad. What determines the outcome comes down to three things most people avoid looking at: why you are doing it, how you are doing it, and how your neurochemistry responds afterward. Some men feel better afterward. They sleep deeply, their mind feels lighter, and they feel closer to their partner. That is a healthy release of oxytocin. But other men feel drained, eyes heavy, energy flat, mind wiped out. And then, a few hours later, they crave it again. Not from real desire, but from restlessness and emptiness. If you have ever been in that state, you are not weak. You are simply stuck in a dopamine loop that the brain learns very quickly. And here's the key point. Instead of asking, is it harmful? Ask, which group am I in? Right now, think back to the most recent time. After you ejaculated, did you feel peaceful and restored? Or did you feel tired, emotionally numb, and needing more stimulation just to feel normal? That answer is what will take us into the next part, where I'll talk about the upside first, because there are real benefits you should understand so you don't live with unnecessary guilt. Have you ever felt this? You are tense all day like a stretched rubber band. Your head is packed with tasks, but your brain won't stop running. Then, after you climax, it is like someone turns the volume dial down inside your mind. That is not your imagination. When you ejaculate, the brain releases a powerful chemical cocktail: oxytocin, endorphins, and prolactin. Put simply, it works like a massive reset button for your nervous system. That is why, for some men, a steady rhythm makes them less irritable and helps them sleep deeper. The release of prolactin specifically signals the body to enter a state of recovery. And don't forget the physical aspect: use it or lose it. During arousal, blood vessels widen and circulation surges. For men over 40, this isn't just about pleasure, it keeps the penile tissue oxygenated and elastic. When your vascular system is exercised regularly, you tend to feel more confident and less worried about performance anxiety. And then there's the benefit that surprises a lot of people: the prostate. A famous long-term study from Harvard suggested that men who ejaculated frequently, around 21 times a month, had a significantly lower risk of prostate cancer compared to those who did it less. The theory is a flushing effect that prevents carcinogens from stagnating in the gland. But hearing that, I want you to ask yourself one question to set up the next part. If there are such clear medical benefits, why do some men feel worse the more they do it? Why do they feel more drained, more emotionally flat, and more distant from their partner? Because the downside isn't in the number, it is in the way you get pulled into a pattern of using it the wrong way. And in the next part, I am going to speak directly about that. There is a very thin line between a healthy habit and a compulsive behavior. You can ejaculate every day and still be perfectly fine if you are choosing it intentionally for relaxation or for intimacy, because your body genuinely wants it. But if you start noticing that you are being pulled by an urge, even when you are not truly in the mood, even when you are exhausted, then it is no longer release, it is being driven. And right here is where many men start paying a price without even calling it by the right name. Your body learns what you repeat. This is called neuroplasticity. If you are always doing it in a rushed state, fast stimulation, quick finish, your nervous system gets trained like it is running sprints. Over time, two frustrating things happen. First, your sensitivity drops because your brain gets used to that aggressive friction, something a partner cannot replicate. Second, when you are with a partner, you finish too quickly because your body is conditioned to that rapid rhythm. Then the emotions kick in, disappointment, insecurity, and the more insecure you feel, the more you reach for stimulation to soothe yourself. Do you see the loop? And here's the part many people don't want to admit. Sometimes you are not horny, you are escaping. Escaping stress, escaping loneliness, escaping the feeling that you are not enough. If ejaculation becomes the only switch that makes you feel okay, you are placing your entire mental health on a chair that is way too small. You will feel drained, emotionally flat, and you will slowly lose your natural drive for life. The emotional peak I want you to remember is this. If one day you realize, I'm not doing this for pleasure anymore, I'm doing it because I can't stand the emptiness, then this isn't about frequency anymore, it is a warning sign. So how do you know where you stand? In the next part, I will show you a very simple self-check to tell whether you are in the safe zone or sliding into the danger zone, so you can adjust without becoming extreme or punishing yourself. I don't want you to leave this video with a rigid rule, like whether daily is always allowed or always forbidden. I want you to leave with a diagnostic tool. Your body always gives a clear answer. The question is whether you are listening. So run these 3 checks. First, check your reason. Are you doing it because you genuinely desire it, or are you self-medicating? If you notice you usually turn to it when you feel sad, bored, or stressed, then what you need isn't a higher frequency, it is a different dopamine outlet. You need to break the dependency on a single escape route. Second, check the effect. After you ejaculate, do you sleep better and feel emotionally steady? Or do you crash? If you feel flat, foggy, and then a few hours later want it again, even though your body isn't truly asking for it, that is the chasing loop. One side is recovery, the other is depletion. Try a simple 7 to 14-day experiment. Track your morning energy and your focus. The data will speak for itself. Third, check your goal. If you are trying to conceive, science is clear. Ejaculating every day may lower sperm concentration because your body needs time to replenish. In that case, adjusting to every 2-3 days is the optimal strategy. If fertility isn't the goal, then focus on quality over quantity. Slow down, focus on breathing, learn tempo instead of only learning finish. And one important reminder, if you have pain during ejaculation, blood in the fluid, ongoing erection problems, or difficulty urinating, don't guess. That is not a frequency issue. That is a medical issue requiring an evaluation. In the closing, I will share the single most important principle that helps you protect your vitality long-term without becoming obsessed with the numbers. Ejaculating too often isn't a sentence, and it is certainly not a measure of your masculinity. It only becomes a problem when you lose the ability to choose, when it pulls you into a loop of exhaustion, emotional numbness, and growing distance from real connection. The strongest thing a man can do isn't to just tough it out or try to prove something. Real strength is having the awareness to observe your body and the courage to adjust at the right time. If you learned something new from this video, leave a comment with the number 1. If you want me to clarify any part, type 0, so in the next video, I can go deeper into exactly what you need most. And don't forget to subscribe because every week we will keep speaking plainly, honestly, and scientifically about men's health. Especially after 40, your body is worth understanding, your health is worth protecting, and your vitality is worth taking control of. I'm Dr. Emily Carter. Thank you for watching.